She's a medical intuitive, a psychic, an Uber entrepreneur, and an author. This is Robert Manni, host of Guys TV, and this week my very special guest is Julie Ryan. You can also catch me on KCAA Radio here in sunny Southern California, and also my worldwide podcast, and of course, our YouTube channel. Guys TV, Guys Radio, thanks for your support. Okay, our interview portion of Guys Radio, and I'm delighted to have Julie Ryan as my special guest today. She's a psychic, medical intuitive, and she can sense what medical conditions and illnesses a person has and facilitate energetic healings. She can communicate with spirits, both alive and dead, and she can scan animals, access people's past lives, remove ghosts from homes and buildings, and she can tell how close to death somebody is. Wow. Her book, Angelic Attendants, What Really Happens as We Transition from This Life into the Next, describes a series of events around angels, multitudes of deceased family and friends, spirits, and deceased, pets, and countless serendipitous and miraculous moments. Her children's books are Angel Messages for Kids and Angel Messages for Dogs, actually. They're picture books that have angels answering kids' tough questions. And each week, Julie scans callers on her show, Ask Julie Ryan. It's a worldwide podcast heard by millions in over 100 countries. She's a businesswoman, inventor, author, podcaster, serial entrepreneur, as you could tell, and her surgical device inventions are sold globally, and she's founded 9 companies in 5 different industries. Julie's psychic and mental intuitive skills are learned. Welcome to Guys Radio, Julie Ryan.
Thanks so much. What a delight to be with you.
Well, I'm so glad you're here. So let's start at the very beginning because it's so provocative, your life. At what age did you realize that you had these gifts, and how would you describe them?
I didn't ever. I learned how to do all of them. I went out to figure out how to learn how to do them. I was given a book about 30 years ago, Robert, by a friend who gave it to me for my birthday, and it was called Anatomy of the Spirit by a woman named Carolyn Mays,
yeah,
who
sure.
calls herself a medical intuitive. And I thought, what the heck is that? Because I'd been in the hospital supply industry for a long time at that point and was very involved in helping people heal, but from the supply side of the equation to help the doctors and the surgeons help their patients heal. And so I read her book and I was fascinated to know more. And back then we didn't have the internet yet. So I went to a bookstore. I went to a Barnes and Noble and I found a book called Hands of Light by a former NASA physicist named Barbara Brennan, who had parlayed very complex quantum physics principles into understandable English for the non-scientific mind. And that would be me. And so I read that, and she talked about using energy to help facilitate healing. And I wanted to know more. So I called her school and I said, do you guys have anybody in my area teaching this stuff? And lo and behold, they did. And so I studied with a woman for 6 years, took classes, paid the equivalent of getting an MD or a PhD to do this. Fast forward 30 years, here I am. I teach it to people around the world. We've had students from 10 countries online, and we condense it and we do it I do it in 4 Saturdays, couple of hours a Saturday. And everybody can do everything that I do. It's not just medical. It's, as you mentioned, talking to deceased loved ones, doing past lives, working with animals, whatever. Because once we connect with spirit, Robert, there's no reason that you can't do it all. It's all the same thing. It's all energy. And it's a blast. We have so much fun doing this. So I teach the class quarterly. Everybody has the ability. We all come in with intuitive abilities. It's just a matter of developing and enhancing them.
Why do you think people are unaware of their abilities, and how easy is it for them to unlock these abilities?
Well, we all do it now. Naturally, we've all had instances where we'll think of somebody and then they'll call us, or we'll get a text from them or an email or run into them. And we'll say, oh my gosh, such a coincidence. I was just thinking of you. Well, there's no coincidence there. That's your intuitive abilities coming in. We were just talking before we started taping, and you said that you were led to go. I think it was, you said your deceased father
Mhm.
was sending a message to you to go to New York and go in February of 2020 before the pandemic really happened. What was happening, nobody knew it yet.
Right.
And so you followed that intuition, you followed that guidance. We all do that. I believe we all have had the ability since the beginning of time. And as we've gotten more well educated, we've become more proof based, and we want facts and we want proof that this is happening and all of that. And I think all of us get gut hits on something, gut instincts, like I need to do this. And if we don't follow what our gut instinct is, guys call it a gut feeling, it's intuition. If we don't follow that gut feeling and we go against it, normally we regret it. So we all have it coming in, we just discount it, or we don't recognize that it's really our intuitive
Mhm.
guidance at play.
What was the most challenging aspect to learning?
Trusting that the information I was getting was valid. And that comes with practice and experience, especially with the medical stuff, because I got to the point where I am like a human MRI. I can see in my mind's eye broken bones, torn ligaments, viral infections, bacterial infections, cancer, or whatever. And I would get these visions in my head, and I knew enough to know what the body parts were. And then as it's gotten more advanced in the work that I'm doing, I see healings all the time. I watch new organs get generated from stem cell energy that can show up on subsequent scans. And I've had doctors call me throughout the years and say, "What are you doing? And how does this stuff work?" Because the scan before showed a diseased kidney, and the person's coming in a month later and their kidney looks great. Or somebody had a kidney removed surgically, and then there's, on a subsequent x-ray, there's a new kidney in there. And they're going, wait a minute. So everything can be healed. And the interesting thing about it too, Robert, is that the different healings that I see can emulate what I saw in operating rooms for decades when I was in there developing products and testing prototypes and the like. Sometimes they use methodologies and devices that haven't been invented yet. And they're really amazing, the healings that I get to see with spirit working through me and with me. And for a long time, when I was first doing this, I was thinking, God, is this just my imagination? I mean, am I hallucinating? What am I doing? And then as validation was coming in, that the symptoms would go away, or the person would heal, or like I mentioned, something would show up different on a scan, then the person starts to trust it. So
What
it's really fascinating.
what you mentioned other doctors, and anytime there's something new, even with things like Reiki or hypnosis, it's in the medical community and big pharma and all that are, they're pretty much put the clamps on a lot of things that are kind of new, which are really things that are very old. Have you experienced much of that from the medical community? It sounds like you've been embraced.
I have been, for the most part. I have doctors that send their patients to me when they can't figure out a diagnosis. I had a doctor that I know recently asked me to come speak at a very large medical school with her new interns and residents this summer to bring this energy healing thing in there. Reiki is being taught in a lot of nursing schools. Reiki is a really
Yes.
good place to start. It's a very elementary energy healing. What I teach is postdoctoral level. So Reiki is a really good place to start. And I have several physicians and other medical providers that have gone through my class to learn this. I've had nursing professors. I've had a world-renowned geneticist go through my class, several physicians, and others in the medical industry. And what's fun is when somebody will go in and they'll be healed from something, and it's not me doing it, it's spirit working through me and with me, certainly, to help the person heal themselves. No doctor, no medical provider, no surgeon, no healer ever heals anybody else. We help the person heal themselves.
Mhm.
And an analogy, I speak in analogies a lot, Robert, because it gives our human minds a frame of reference for this woo-woo stuff that we're talking about. And one of my favorite analogies for this is if you think of a surgeon that has back-to-back surgeries that are the same procedure, both healthy patients, both surgeries go perfectly, recovery goes perfectly. One patient heals easily and quickly, the other one doesn't. Why is that? Because one person's spirit wants to explore and experience healing quickly and easily, and the other one doesn't. That's the simple answer. And so it's the same with this. The healings that I do, I believe, are part of the equation of healing. They're a piece of the puzzle to help people heal. And more doctors are understanding that, and they're proof-based. My 12 phases of transition is what I call when somebody's dying, how angels and deceased loved ones, spirits, and the spirits of deceased pets are there to welcome us as we're dying. That 12 phases of transition that I see with everybody that's dying, university-based research corroborates all of it. There was a study done in Buffalo, New York, by a hospice director named Chris Kerr, who is an MD and a PhD, and he studied 1,400 patients that talked about, close to 90% of whom talked about seeing deceased loved ones and deceased pet spirits, either in dreams or in visions at the end of their lives. So I love it when science catches up with woo-woo, and that's what I see happening. I think more and more people are becoming open to it. And the doctors that have a tough time with it are not people that are going to work with me, but certainly I'm happy to talk with them. And when I nail something that there's no way I could have known, like this world-renowned geneticist who took my class, I did a scan on him and he came up with stuff that there's no way I would have known. I didn't know him.
Mm-hmm.
And so that's
Okay.
how it works.
All right, Julie Ryan, my special guest, medical intuitive and psychic. How do you kind of parse between the difference between your psychic skills and the medical intuitive skills?
All one and the same.
Okay.
All one and the same. Connecting in with spirit. So it's my spirit connects with the person's spirit that I'm scanning. I never scan anybody without their permission. If you want me to scan your wife or another family member or a friend, I'll ask their permission telepathically.
Mm-hmm.
And if I don't get it, I won't scan them. I can, but I won't, because I believe it's a violation of their privacy. Mm-hmm. Now, I'll talk to their spirit, and I don't have a problem with that from an ethical standpoint, because it's kind of like if you had pneumonia and you and I were having a conversation, you would tell me what you wanted me to know about how you were feeling, but I wasn't looking at your x-ray without your permission. Mm-hmm. That's how I equate those two things.
Is this something that you can turn on and off as you choose? Like, for instance, you go to the supermarket, somebody's online in front of you. You're like, maybe I'll scan them. I'll ask their higher selves. And you take a look and you're like, oh, they've got a problem there with his kidneys or something. Is that how it works with you in your day-to-day life? Just curious.
Yeah, I turn it on and off at will. I don't walk around scanning people. I don't walk around with dead people chasing me or talking to dead people, let alone, what I would have done if I had that information. So yes, no, I absolutely turn it on and off at will. And okay. I live a normal life. I'm a mom, I'm a wife, I'm a grandmother, I'm a great grandmother. I do the laundry and cook dinner and make my bed and just regular stuff. So yeah. And this is a fun side skill set that I've developed, that I've learned. And so, yeah, it's a blast. And I get to meet people from all over the world, mm-hmm. which is fun. And it's terrific.
All right, let's talk a little bit. You mentioned death before and transitioning, and you talk about the 12 phases of transition and people going through kind of similar experiences, universal experiences of dying. Could you talk to us a little bit more about that?
Sure. What happens is when we're dying, our spirit exits through the top of our head. You hear about near-death experiences where people are feeling like they're going through a tunnel. And that's what I perceive. And the spirit hangs on to the top of the head, Robert, and it looks like a cartoon caption where you'd see where the words or the thoughts of the cartoon character would be. Mm-hmm. And then what happens is the person's closest deceased maternal relative comes in, and they are the one that runs the show from the spirit world. And then a paternal spirit comes in, either our father if we're dying or our maternal grandfather. And if he's still alive, then our maternal great grandfather. And then the maternal spirit, the mother or the grandmother spirit, is the one who calls in the angels, calls in the deceased loved ones, calls in the deceased pets. It's really an amazing series of events that takes place where these angels come in, they surround the person in a circle who's dying. As the person gets closer to death, they open up into a horseshoe, eventually into a straight line at the foot of the bed. Everybody goes through 12 phases of transition, Robert, whether they die in a situation where it's an instant death, like a homicide or a suicide, or whether they die and it's prolonged over days, weeks, months, even years. Everybody goes through the 12 phases of transition. The important thing to remember is that time doesn't exist in the spirit world. Time is a human creation. So somebody that's dying instantly or dying over long periods of time, it's the same thing in the spirit world.
So everything's happening at the same time.
Mm-hmm.
So then conceivably your children could be on the other side greeting you, even if they're alive now. Does that make sense?
What my experience has been is that it's the deceased loved ones.
Okay.
Deceased people.
Is that to make it easier for people because we're used to the linear timelines?
Well, yeah, not only that, but the people who are still alive, their spirits are attached to their body. What I see are spirits who are in pure non-physical. Mm-hmm. Okay. Whereas our children that are still alive or other loved ones who are still alive, their spirits are still attached to their bodies.
So one of the most fascinating things that you do is you can tell people kind of when their kind of due date is up. So I'm wondering, is this something people want to know? And is there anything that people can do to shift their timeline?
Actually, I don't tell them when they're going to die. I can see how close to death they are based on what phase of transition they're in. But I think it's important to remember, Robert, that we all decide when we go, where we go, who's with us when we go, and what the circumstances are that surround our departure or our transition. And everybody is in control, even somebody who's shot and they die because they're shot through the heart or whatever, instantly. That person who's shot, the victim, decides if they're going to go from that gunshot or not. And they decide where they're going to go and how they're going to go and all of that. It's been my experience also that we don't have a set date. There are some schools of thought that you have kind of predetermined dates of when you're going to go. And I don't find that to be the case. There are lots of instances that I've experienced and also that are just well known with celebrities or other people that we hear about in the news, where one of my favorite examples is Debbie Reynolds. When her daughter Carrie Fisher died, they were so close. She died perhaps on a Friday and Debbie died the next day on Saturday, and there wasn't anything wrong with Debbie. They were just so close. She didn't want to live without her daughter being alive. There are many instances where you'll hear of people that were married for 70 years and one of the spouse goes and the other spouse goes within a matter of a few days or a week. And we'll say, well, he died of a broken heart. Well, okay. I mean, there are just endless instances of that. So no, but the important thing to remember, especially coming out of the pandemic, for all the people who've lost a loved one and they weren't able to be with them, I think it's really important to mention that nobody dies alone. We're all surrounded by angels and deceased loved ones and the spirits of deceased pets. And it's glorious. It's a glorious component to what is normally a heart-wrenching situation.
So is life as we know it a fluid experience, or are we locked into agreements, karmic debt created prior to our current incarnations? And can we change those?
Great question. We are not locked into anything. We are here to create. And we create out of the contrast that is our life. So when we see something that is less than optimal, we create what it is we want. We all decide also when we go, but we all decide when we are born, to whom we're born, the circumstances into which we're born. So our lives can have a basic trajectory, which will allow our spirit to explore whatever it is we're coming in to explore. And so, yeah, it's really fascinating how this whole karma thing, if you don't
Hmm.
get it right in this life, you got to come back and get it right in another life. I don't believe that. My take on that, Robert, is we come in with a script of something we want to explore, and we'll explore that script perhaps through multiple lifetimes, different timeline, different gender, maybe, certainly different location, different set of circumstances, same basic script. And then each time we explore it, we expand out from that. Our spirit explores and expands. And an analogy I like to use for that is think of Shakespeare's Hamlet. How many times has Hamlet been performed? I don't know if we could even count, because people perform it in their homes or in their neighborhoods or whatever. But you think about, I think Shakespeare's been dead about 600 years. Think about all the times that play's been performed since he wrote it. Think about what was the timeline, what was happening in the world at the time, who were the actors, who was the director, who were the costumers, who was the set designer. Same script, different perspective, different interpretation. And that's how I see our lifetimes. We all live thousands of lifetimes. And that's how I perceive it.
Okay. Okay, Julie Ryan, medical intuitive and psychic, my special guest on Guys Radio. How do you communicate with the deceased, Julie?
I ask them a question and they're going to respond that fast, as fast as you can snap your fingers. And it's going to come in like a thought in our head. And how you know that it's them, it's instant. It's an instant reply. Ask a question, make a statement. When we think about it for more than a couple of seconds, that's our brain talking to us. Our heads are big satellite dishes, Robert, and they receive and they transmit frequencies. So in order to get in touch with somebody who's deceased or alive, it doesn't matter. We're connecting with their spirit because our spirit keeps the same frequency throughout all of our lifetimes. All you have to do to connect with somebody is just think of them. So for instance, you mentioned your dad's deceased. You want to talk, you think of your dad immediately comes in. If you're doing something random, like driving down the street, thinking about the grocery list in your pocket or something, and your dad comes into your head, that's your dad letting you know he's with you. And you can do that with anybody. It doesn't have to be just with somebody that you knew when they were alive. You want to talk to Napoleon or Mother Teresa or Aristotle or whomever, it doesn't matter. You just think of them and then you can communicate with them. It's really that simple.
It's interesting. I recently interviewed Anita Morjani, who has a famous book on near-death experience, and
Right.
We were having some hiccups in terms of getting things scheduled. But I just decided I'm not gonna let it go, and I actually asked Wayne Dyer to help me out because
Yeah.
he was a big proponent of her work, and sure enough, we did our interview and it came together, and it was fantastic. So
Yeah.
I'm all with you on that.
Actually, I haven't met her, but we share the same book editor. And I
Okay.
understand she's really lovely.
Fantastic.
Yes.
Really
Yeah,
love.
that's what I've heard.
She's for real and a very, very gentle, yet very knowing and very authentic.
Mhm.
What can you tell us about past lives and their significance in our current lives?
Past lives are really fun, Robert, because oftentimes we can get information that we can corroborate with historic data or census data or whatever online. So, how it can affect our current life is, again, back to that script that will run through multiple lifetimes to look at different perspectives. For instance, let's say you were a painter in a past life and you wanted to paint in oils and you did that, and then you were reincarnated into another life and you wanted to paint in oils again, but it was a different time, different topic, different materials that you could use, things like that. And then maybe you wanted to be involved in painting, but you were a broker or you were a paint maker or you were a whatever. It's all basically the same script. It's just looking at it from different angles, if you will. So past lives, I have a couple of stories I think that can
Please.
illustrate how
Please.
it works really well. One of my favorite ones is about a gal who lived in London, Italian gal, born and raised in Italy. She was living in London, and she and I did a consult, and she said, "I always choose the wrong men." She said they're not available. They're either married or they're in another relationship or they don't want to commit or whatever. And she said, "Why is that? Do I have a past life that's facilitating that? What's going on with that? So we did a past life scan, and I'll explain what that is in a second. Well, what we found out was she was a geisha in the late 1800s in Kyoto, Japan. Well, geishas are taken care of by a sponsor who's normally married with a family and can't commit because they're already married to somebody else. So when I said, well, you were a geisha in Kyoto, Japan, and I gave her the year, and she said, she gasped. And I thought, oh, Lord, well, what's that all about? And she said, I worked for ANA Airlines and my training was in Kyoto, Japan. And she said, when I got there, it felt so familiar. And she said, matter of fact, the first day I was there, I was in the cafeteria with all these Japanese girls. And she said, ANA is All Nippon Airlines. So it's the Japanese airline. And she said, I had never held chopsticks, let alone ever used them. And she said, I knew how to use them better than the girls that had grown up using them. And they were all saying, what's up with that? With this little Italian girl, using chopsticks better than we can. So what we got was, not only did it make sense why Kyoto resonated so much with her because she lived there in a past life. She said when she went places, they were familiar. She said it was like the whole trip was deja vu. She knew places. She knew how to get to places that she shouldn't have known. And then it made sense to her why she wasn't able to choose a man in this lifetime that was available. And just by knowing that, creating from the contrast, she created a relationship now, and she's engaged to be married. So
it sounds like people need to put themselves in a position of, people talk about manifesting all the time, and they're always trying, they do the protocols and feel like it's already happening and all that. But I always wonder if people, for some reason, I think that people have a problem receiving and allowing, if you will, and that really gets in the way. If you agree, do you agree or disagree? And if you agree, what can people do to make themselves more available to allow things to happen, to be able to tap into the power that they have and live kind of inside out, the universal energy, be able to work with that instead of the old man in the sky with a beard, know that spirit is within and work inside out and know that everything there is available for us. How can people kind of get started in living a different way? You know what I mean?
Well, I think that's a really good point. First of all, you have to take action. People say, well, yeah, I'm manifesting this. I'll say, what are you doing? Well, I'm thinking about it every day. And I'll say, yeah, well, you want to meet the man of your dreams or the woman of your dreams. You need to take action. Get on a dating site, go out and be amongst the people. Let people know that you want a relationship, because somebody's grandma may know somebody who has a grandchild that they can introduce you to or whatever. So that's the first thing, take action, and then give up how it's going to happen. Because when we try and control how something's going to happen, not only does it restrict how things can unfold, but we're trying to control something out of fear. And when we're in fear, we're out of alignment with our spirit. And so I came up with a technique. May I share it with you of how to get back in alignment? I call it the 2-minute rule. And you're going to love it because it's free and it's convenient. It works anywhere your brain is. And your brain's usually with you wherever you are. So here's how it works. Again, our heads are satellite dishes. They receive and they transmit frequencies. Every spirit has a frequency. Every thought has a frequency. Thoughts originate in the ethers and we pull them in based on what we're thinking. And granted, we're all hardwired for fear. We're waiting for the saber-toothed tiger to come around the corner and eat us for lunch, although he's been dead for millions of years, right? So what we want to do is when we have a thought that comes in, we want to pay attention to how it feels. Emotion is an internal GPS system that we have. If a thought that we're thinking feels neutral or good, we're in alignment with our spirit. If a thought feels bad, bad can be boredom, jealousy, anger, fear, whatever, fatigue, whatever. We want to be able to discern between, is this a rational fear or is this an irrational fear? So here's how you do it. When you're feeling badly and you're having a thought that feels badly, you ask yourself, is this going to kill me in the next 2 minutes? I call it the 2-minute rule. If it is, get out of the street before the bus runs you over. If it's not,
I love it.
Then it's false, because it's based in a limiting belief, which is false, which is based in an irrational fear, which is false. And as soon as you go to curiosity and you ask, is this going to kill me in the next 2 minutes? It breaks that connection of those thoughts coming in on that frequency, raises your vibration because curiosity is based in love. Curiosity, you want to know more. It's fun. It's interesting. And so then you ask, how is this benefiting me? Well, it's benefiting you because it's pointing out a limiting belief that's fake, causing an irrational fear that's fake. And you can use it a million times a day.
I love it.
It's free. It's convenient. The 2-minute rule. So when we find ourselves feeling like, okay, I'm manifesting this. I'm doing everything I'm supposed to do. I'm standing on my left foot and raising my right hand and drawing circles in the sky or whatever. But it's not happening. It's not happening. It's not happening. And it feels bad. You know, you're out of alignment with your spirit. Spirit doesn't communicate on the I feel crappy channels. You got to get back into alignment to have inspiration come in. And inspiration's going to come in like a thought. Maybe I'll look at this website. Maybe I'll go to this event. Maybe I'll talk to this person, whatever. And you take it a step at a time.
When we're talking about past lives, I want to ask you a question. I'm not asking you as a trick question or anything. I'm just curious. And that is, when you explore past lives, and if time's happening, everything's happening at the same time, can you, and I mean you specifically, but you right now, look at future lives for people that you're scanning?
Yes, absolutely. And it's important to know that things that have happened in the past are set. Things that are happening right now are set. Things that are happening in the future are fluid because there are a bazillion variables that come into affect an outcome. So when somebody says, can you tell me when's my house going to sell? When am I going to get this new job? When am I going to meet the love of my life? When is my baby going to be born? I had a woman call into my show last night who's trying to get pregnant, and I can see baby spirits that attach to the mom's energy field before they're conceived. And this woman called in and she said, we've been trying. We're doing the IVF thing. When is my baby going to be born? I said, you're not supposed to know. It's part of the adventure. Quit trying to control it. You're blocking it by trying to control it. So I don't know that she appreciated that answer, but it was the answer I gave. So I think it's good for us to know that we're supposed to take things a step at a time because of all those variables that can come in to affect an outcome. Global pandemics, somebody's free will, somebody else's free will that affects a situation. And when we think too far in advance, Robert, we go into brain freeze because there's no way we can be able to imagine what all those variables are that are going to come in that are going to affect an outcome. So it's one step at a time.
I would think with that in mind, that when people, for instance, I've been meditating a lot for the past 7 months daily, and now my channel seems to be pretty flowing. And I'm not saying, oh, that's monkey chatter. I'm getting go, go, go type messaging. But also the other day I was told, just say what you want, like basically state what you want. And I think people need to be able to do that when communicating with spirit, but be open to what you're stating helps put it in motion, but don't expect it to be exactly how you're describing it or you're timing it, because it could be a lot better. And you're really limiting yourself.
Exactly. I agree. And you bring up another really good point, which is spirits are really literal, super, super, super literal. And how applicable the guidance is that we get from them is going to be predicated on how we ask questions or how we make statements, because we're going to interpret it through our frame of reference. Let me give you an example. If you ask your dad, hey, Dad, are we going to enjoy the movie? And you get a yeah, comes in a heartbeat. So you and your wife are watching some movie tonight and it's atrocious. You're thinking, Dad, what's up with that? Well, he gave you a correct answer, which spirit always will give correct answers. But how you ask the question could pertain to any movie you're going to watch throughout the rest of your life. Whereas if you said, hey, Dad, are we going to enjoy watching The Blind Side tonight on Netflix?
Got it.
See the difference. The other thing is spirit is always going to give an answer that's going to either feel neutral or good. Spirit will never come in with anything that feels abusive. I've had people over the years, Robert, say to me, "Oh, I've got this spirit and it's really abusive and it tells me all this awful stuff and it's terrorizing me." And I say, "Spirit's pure love. That's your brain doing that to you. Spirit is pure love. Spirit is never going to say anything that's going to be abusive. Evil spirits don't exist. It's our fear that that's our frame of reference. We're processing the information through our fear. And that's when you use the 2-minute rule. It's going to kill me in the next 2 minutes. No, if it's not, it's false.
I love it.
Fake news.
Okay. You work a lot with pets. What is the significance of that? I think that's wonderful. Is that something you specifically wanted to do, or is it something that came to you like, hey, I can really be good at this, and I'd love to do that because I love animals?
Well, back to what we were talking about earlier, which is when you connect with spirit, you can take it anywhere you need to take it.
Okay.
So animals are the same as humans, and you can communicate with an animal that's alive or an animal that's deceased. It doesn't matter. You just ask a question or make a statement and they're going to respond, and it's going to come in within a second. So I do healings on animals a lot too. I can scan animals and
do you have to see the individual? So let's say, for instance, a cat or a dog or whatever. Do you have to ask the cat's higher self, can I work with you? And do you have to physically see the cat?
No and no.
Okay.
No. I ask spirits of humans if I'm going to scan them for a medical reason. I ask their permission, but no, I don't ask animals permission.
Got it. Okay.
And no, I don't need to be with 99.99999% of the scans that I do and the work that I do is remote. So I'm not with the person or the animal ever. And I don't need to see a picture of them. And I normally just talk to them on the phone. I don't even usually do Zoom.
Okay. Julie Ryan, amazing stuff. She's my guest on Guys Radio, medical, intuitive, and psychic. Time for some fun, Julie. We talked about this prior to the show, and I figured let's just do it. So feel free to scan me. And I asked my keeper of the threshold to work with me on this. And he said, yeah, do it. And what do I need to know right now?
What's your keeper of the threshold? What's that mean?
My kind of guardian angel, higher self.
Oh, okay. Okay. Your spirit guide or a guardian angel?
Yeah.
Yeah. Well, do you have any symptoms that you want me to check?
I had an appendectomy emergency in October, and they just got it in time. And then I had, they said, you really were at the point of heavy infection, almost kind of getting the best of you. So we had to spend a lot of time cleaning you out, and I had heavy duty antibiotics, and I felt fine. Since then, I bounced back. I'm a pretty healthy, strong guy, but I've noticed that and I'm pointing for those listening, the upper part of my abdomen that I don't know if they stretched the fascia or it's still a little bit tender. And it's like because they pump you up with air and everything. And I'm wondering if that's just naturally going to go back. Is there anything I need to be concerned about? Can you heal it?
Are you having heartburn or reflux?
No.
At all? It's just
my digestion. My digestion. It's better than ever. Before the appendectomy, I was having that, and then it was at the point of I think it died inside me. That's what the doctor told me, and he said you had some infection around there. We really had to work hard. What took you so long? And I think my body was so healthy that I walked around with a dead appendix in me for a while because it was blocked. So anyhow, since that happened, I've just felt that it's not, it's 90%, but it's just not 100%. And I feel it puffed me out a little bit. I don't feel like it right here. It's just a little bit where you can like boing, it goes in and out. And it doesn't feel 100%.
And so you don't feel it when you eat something that you get bloated or anything.
Not at all.
Okay, it's just puffed out now.
Yeah, it's just a little bit. It's going down a bit, but it's like it's not fat, but it's like pushing in on a soccer ball or something that doesn't have enough air. Or a balloon where you push in and it comes out. And I think it's because I'm just guessing that, they pump you up with a lot of air and move stuff around when they go in there to do
Yeah.
robotic surgery. And this was
Right.
an emergency. They had to get it. And
So they didn't open you up. They scoped you to get it out.
It was like a robotic thing that they did. They went in and they took it out they said it was 15 minutes for the operation and 2 hours to clean me out. So I guess I was opened up for a while. And before I went in, I was laying on my living room, bedroom floor, and I started to leave my body. And I pulled myself back in, and a voice came over me and said, "Don't drink alcohol." And I stopped. I wasn't drinking a lot anyhow, but I was drinking, I live in Southern California. I like to have tequila now and then, and there's a lot of good wines, but I stopped. And that was 7 months ago. And because I listened, but I don't feel like I'm 100%, but I feel I'm going there.
Yeah. Okay. So what I'm going to do, Robert, is I'm going to raise my vibrational level to the level of spirit. I'm going to close my eyes. I'm going to watch a laser beam come from my body here in Birmingham, Alabama. It's going to hook into you in San Diego. And then I'll have a hologram of you in my mind's eye.
Okay.
And then I'm going to envision shooting energy from your feet up through the top of your head. And then we'll take it from there. Something will be identified. There'll be some kind of energetic healing that will happen right after that. And so let's look at that. So here we go. Here comes my laser beam I always say from Sweet Home, Alabama, heading to you in California. But I think it's Arizona. Is that the song? I'm putting the wrong words to the song.
Sure.
Got you. Okay. I'm going in. I've got you on my radar. I'm going in, shooting energy from your feet up through the top of your head. I'm in your esophagus. Basically is what I'm doing. And it looks like the lining of your esophagus is healing. Looks as if, how can I explain this? My visuals sometimes are really hilarious because they're just coming into my head and I'm going to tell you what I'm seeing in my mind's eye and come up with an analogy, because if you can envision it, it's going to help integrate the healing into your body. If you had a tube, your esophagus, and you had a sleeve inside of it, a plastic sleeve, and there was a hole in that plastic sleeve and there was air, like in a double pane glass window, air was getting in there. That's what I'm seeing.
Okay.
I'm not seeing a hiatal hernia. I'm seeing something similar to that hasn't developed into one yet. When you have a hiatal hernia, you'll feel it. You'll get heartburn, you'll get pain in your chest. Some people think they're having a heart attack and they're not. It's a hiatal hernia. So what I'm doing is I've condensed the air, kind of like if you put something in a Ziploc bag and then you push down on it to get all the air out before you seal it. I'm pushing it between the two layers. As I'm looking at you from the front, it's on your left, my right, about halfway down your esophagus. What happened there? My guess is you had a hiatal hernia when you had the surgery that's still healing. If you said you had heartburn before the surgery,
yes.
Yeah,
Often.
that's usually from a hiatal hernia.
Okay.
So I'm using stem cell energy, Robert, to heal it. Stem cell energy is the coolest stuff because it'll regenerate any body part we need. That's what I was talking about earlier with the kidneys and livers and whatever body part that we need. So I've got stem cell energy. Stem cell energy looks like a light amber colored gel. It has sparkles in it because it's woo-woo. Got to have sparkles in some of this stuff, to make it fun. And it has a watery consistency to it. My guess is your wife probably will remember a hair gel called Dippity Doo from the 60s and 70s.
I remember it too.
It reminds me of Dippity Doo. Is that hilarious? And so there's a vortex that's spinning above your chest now, and it looks like a funnel cloud, like a tornado that's spinning. And that centrifugal force that motion is what transforms the stem cell energy into new body parts. And if you think about it, every cell has a nucleus. Every nucleus is surrounded by cytoplasm. Cytoplasm is a watery gel like Dippity Doo. And our bodies act as mini nuclear reactors, Robert, and we have a centrifugal force that spins inside of our bodies, and that's what helps our cells divide and replicate. So I'm watching in warp speed happen what our bodies do all day long, to the tune of hundreds of thousands of new cells, if not more, every day. So I'm doing that. And then I'm shooting energy from your feet up through the top of your head again. So I believe this was a hiatal hernia that's still healing. And the sore part of it is gone, but it's not completely healed yet. And that's what you're feeling.
I think you're 1,000% correct, because the doctor mentioned to me the possibility of that after the surgery. And I was like, what? And then I started thinking about it, and I'm like, well, maybe that's it. But I didn't want to mention it to you because I figured, well, let's see what happens. So right on,
Yeah.
Julie. Thank
Yeah.
you. How
Yeah.
long will it take then? What's, ballpark expectations in terms of it completely, back to normal? Because sometimes they say, the hernia, they'll never get better. And I don't believe that.
No. Yeah, I don't believe it either, because everything can be healed. The other thing that I want to check real fast is I was checking for scar tissue in that area. And scar tissue, Robert, looks like that fake spider web stuff that you see at Halloween that you can get in the dollar
Sure.
store,
Yeah.
that you can
Mm-hmm.
use to decorate. And I don't see it there. I do see some where your operative site was. So I'm cutting it out with a pair of energetic scissors. It reminds me of when a basketball team wins the championship and they cut the net down
Mm-hmm.
off of the hoop. That's what it kind of looks like, because scar tissue just kind of looks like spider web. It's these strands, and it can affect movement. When will you heal? Let's see if what we can get as far as what you can do to help. I agree. Don't drink, because fermentation is going to mess up your gut at this point. Stay low on the food chain. If God made it, eat it. If man made it in a factory, do
Mm-hmm.
your best to avoid it. You're probably doing that already.
Yes.
Focus on your immune system. I'm getting D3 is very important for you to be taking that. Do you take it now?
Yes.
D3, 8 to 10,000 IUs
Okay.
a day. Ramp it up as far as the amount. C is good. Take the ester C because it's buffered. I would take 1,000 milligrams a day of that, 50 of zinc. And you're on the mend. I don't think it'll be that much longer. These healings will integrate into the person's body. That can happen instantly. It can take days, weeks, months. It may need some kind of complementary care, like change in diet,
Okay.
change in whatever. But yeah, you're healing.
Fantastic.
You look good for the most part.
Thank you. And thank you very much for that. I'm super appreciative. Julie Ryan, the amazing one, psychic, medical intuitive. Let me ask you one more question about myself, if I may. My work. Been at it, doing this for a while. I feel very good about it. Want to take it to the next level, want to serve more, want to reach more people. What do you see?
Well, what does that encompass? Do you want to continue with the podcasting? Do you want to branch out? What do you want to do?
Well, however, I would love to have a television show. I would
There you
love
go.
to, have more books out. I would love to be able to, speaking engagements, just continue the work I'm doing. I love doing the radio show and the podcast. I like to keep that, but a bigger platform.
Yeah, create it one step at a time. Focus on what it is you want. What do you want? Expect the people to show up when you need them, and they will. And so you can take this as far as you want it.
Fantastic.
Yeah, absolutely. The one thing I'm getting is for you to be a guest on other people's shows.
Okay.
And that will really help spread the word as well. So why don't you come on my show?
I would love to.
Let's do that first. And then we can do that. But to be on other people's shows, because that's going to get your name and your message out. And people are always, my show's a call-in show. So what I'll do is I'll have you on for the first 10 minutes or so, just to talk about you and your work and how people can find you. But most shows are like this. It's an interview type show.
Right.
So you want to get on shows, and we can talk about that offline as far as how is a good way to do that. But that's the big thing that came in for me is for you to market yourself through other people's shows.
Great. Okay. So, Julie Ryan, medical intuitive and psychic, tell everybody what they need to know out there about your work, how they can find you. I know you had a promotion you want to talk about.
I
Take it away.
do. I'm happy to send a free copy of my book, a digital and an audiobook version of my book, Angelic Attendants, What Really Happens as We Transition from This Life into the Next. And also my children's books are Angel Messages for Dogs and Angel Messages for Kids. So all you have to do is just go to askjulieryan.com and go to the Ask Julie button and just say, hey, I heard you on Robert's show, or I heard you on Guys Guy Radio, and I would love a copy of your book. And we will send you a link to download the digital and the audiobook versions. Also, my class, all the information on my class and my show and private consults and everything else you want to know about me is at askjulieryan.com. All my social media is at Ask Julie Ryan as well.
Fantastic.
Facebook, Twitter, Instagram, YouTube.
I'm
You can
following you.
download
I follow you
my
everywhere.
show. Yeah, download my show anywhere you get podcasts. We do a video of it as well, and that's released on
Okay.
Dropbox, not Dropbox, on YouTube.
Got it.
And so, yeah, so askjulieryan.com.
All right. Well, thank you very much, Julie Ryan, for being my special guest on Guys Guys Radio. I hope we can do it again. And thank you.
Oh, my pleasure. Thanks for having me.
If you enjoyed the interview and you want to support our efforts to bring you the very best content to help you live your very best life, please subscribe to Guys Guys TV here or subscribe to my podcast, Guys Guys Radio.